So an ankle sprain is a traumatic injury to the ankle, and it means injury to the ligaments of the ankle. One of the most common ligaments that's injured are the ones on the outside of the ankle. If this is the foot here and this is the ankle joint and this is the outside, it's this region here. The symptoms that you would have is a lot of pain, bruising, swelling, and also difficulty with weight bearing. If you can't weight bear, I'd really recommend getting that looked at and an x-ray to make sure that there aren't any fractures there. The way of managing these injuries, so I tend to use the acronym RICE. So it's called rest, ice, compression and elevation. So after this acute injury, it's very painful, it's very swollen, and the first thing to do is just to rest the ankle first, apply ice in the form of cold peas and wrapped up in a towel, and that will help with the swelling. Followed by compression. Now sometimes you can use a tubey grip just to help with the swelling, and that will help compress the ankle as you're mobilizing. And also elevation, and that's keeping it on a pillow, using your foot almost like a drain pipe to allow the swelling to come down, and that will really help the recovery. The recovery from an acute ankle sprain can take many weeks, but it's really important to keep the ankle moving. So the first exercises to do is to bring the ankle up and down, so moving the foot up and down to try and keep that motion there. And as the pain and swelling improves, and that can take a few weeks, start doing things such as writing the alphabet with the ankle, and that's a really good way of keeping the ankle moving and keeping all those joints supple and the tendons gliding as well across the ankle. So if the symptoms don't settle down and it's been over 6 weeks and you're still getting a lot of pain, swelling and the other symptoms such as clicking, a popping sensation, or you feel that the ankle is giving way or you don't quite trust your ankle, then it's probably worth seeing a specialist about it, who may be able to do further tests and examine your foot and look for any sort of signs of injury and management from there.